Today, we're going to discuss what protein in the urine implies. We already discussed in the previous video what it means. Today, we're going to discuss what are the implications and the causes. Yeah. So, for those who tune for the first time, I'm Dr. Francisco. I'm a specialist nephrologist and a transplant immunologist working at Francisco Kidney Medical Center in Singapore. Welcome to the bite-sized information for kidney diseases and related conditions. This video blog is basically destined to help patients with kidney problems or at risk of kidney problems or their relatives to understand better the disease so they can control their disease better, minimizing worries and complications, and take better decisions with their own doctor or with me if I'm their doctor or if they choose me eventually. So let's start. What protein leaking in the urine implies? So what are the implications of protein leaking in the urine? So protein leaking in the urine, what we refer as doctors as proteinuria, is typically an indicator of ongoing kidney disease, either inflammation or scarring. There are multiple causes of protein leaking in the urine. Sometimes the amount of protein lost in the urine can point to certain diseases over others and also have different implications. But certainly, in most cases, losing protein in the urine is not normal. But there are always exceptions. In fact, proteinuria is a risk factor for kidney disease and a risk factor for eventual total kidney failure. This does not mean it's going to happen to you, but patients with proteinuria have higher chances than people without proteinuria. Also, that risk is higher if together with the proteinuria, there is also leak of blood in the urine, what we call hematuria. So I repeat those terms. Proteinuria means protein leaking in the urine. Hematuria means blood leaking in the urine. So if you have two together, it's worse than you have one or the other because it indicates a more severe inflammation of your kidneys. So definitely, you should get it investigated if you are discovered with proteinuria, as opportune detection of a treatable cause could protect or save your kidneys. And as we've been discussing, the kidneys are vital organs. For this, you will need to see a specialist kidney doctor, like me. The assessment of the specialist doctor might include specialist blood tests to detect certain causes of glomerulonephritis, which indeed are pricier, are expensive, but they are necessary. In occasions, a kidney biopsy is necessary as well. A kidney biopsy that we will discuss with more detail in another video means taking a small sample of the kidney, doing a procedure to examine it under the microscope and try to find what is the cause. But as everything in life, there are few instances where proteinuria might not be associated with heightened risk. So meaning that maybe it's not so dangerous. Some people leak protein during exercise, some others while having fever or while having a viral infection. And these type of causes of protein leaking in the urine are regarded as benign because they are intermittent, so it happens once in a while. They are transient, just for a while, and do not cause significant injury to the kidneys. But only specialist assessment might help you differentiate if it is a worrisome cause or just something that might be part of yourself, how you react to some insults like infections. But let's enumerate the most common important causes of protein leaking in the urine. Definitely, the number one, the one I'm trying to combat with my health enhancement abuelos program that also I have. I'm not just doing a short advertisement, but because diabetes is taking over the world, so diabetes is the most common cause of protein leaking in the urine, and also the most common cause of kidney disease, and the most common cause of kidney failure and dialysis, and and has got multiple complications and push patients to have a life with poor quality or poorer quality, and in many occasions a shortened quality. So that's why the um, prevention is better than cure. And that's why I'm trying with all these um, videos, try to allow you to learn more about your condition so that you can manage it better and maybe minimize the risk of developing total kidney failure, or maybe not at all. Yeah, and when you are better informed, you will take better decisions. And if you act earlier, it's more chances to have a different impact. So that's the reason. That's why this group exists. And that's why you should put like, you should share it, you should invite people to come, and you should comment and like my page, yeah, Francisco Kidney Medical Center, yeah. Okay, sorry for a parenthesis, but diabetes is the most common cause, yeah. So the second is just the inflammation of the kidneys, what we call glomerulonephritis. There are many types of it. It's indeed a group of different diseases that cause protein leaking or blood leaking or both. And many of them can also end up in total kidney failure in some years or decades. And there are some very severe that they can do it even in a few weeks or days. So fortunately, those more severe and dangerous are not that common. But that's why it's important to do, see the doctor when there are suggestive signs or you have any symptom, or a test becomes positive, yeah. But what, because the high risk of that, I'm just suggesting you not to leave, unattended any kidney disease. Unfortunately, many of the patients I have treated, they have all unattended because there was a minor symptom, because it was little, and life takes over, the busyness, the stress, the chores, the work, don't take very good care of your health, you forget about it, suddenly start having symptoms, you go to see the doctor years later, and you have total kidney failure. So please don't let your disease unattended. Don't just say because you feel fine, you don't need to do anything. Remember, we go back to watch the videos. Usually there is no symptoms of kidney problems, only when the disease is too advanced. So be careful, yeah. So don't leave any hint of kidney disease uninvestigated, unaddressed, as I mentioned, because it's usually painless, yeah. And patients with proteinuria might be treated with something we call anti-proteinuric medications, which are medications that reduce the leaking of protein in the urine by reducing the blood pressure inside the kidney at the microscopic level. So reduce the injury. If the blood is very fast, the pressure is very high, injures more the microscopic structures of the kidney, more leaking of protein. So by regulating the pressure, making it smoother inside the kidney at the microscopic level, these medications can help people with proteinuria, but not everyone can take them. There are some side effects as well. Consult your doctor or consult me, yeah? So, because they protect the kidney to a certain level. Then obviously treating specifically the original cause is vital, especially if glomerulonephritis is the cause, but also if diabetes or high blood pressure. Not for not being as dramatic as the other, and you need to, or being so common doesn't mean that you need to pay second degree attention to them. No, on the contrary. Irrespective of the cause, improvements in diet and lifestyle are also important to prevent further insults and injury to the kidney. And some of them might require some specific treatments like immunosuppressive drugs, steroids, etc. But maybe we can discuss in another different videos. So in Francisco Kidney Medical Center, we perform screening and confirmatory tests for kidney disease when we identify proteinuria or hematuria, and we advise our patients what are the following steps and the likely journey that they need to follow, but we walk hand in hand with them. So I hope you found this video useful. But please try to invite your friends or anyone that you know has got kidney problems, at risk of kidney problems, to join the group. I'm sure that it will be helpful. If you watch this video, remember, press like. It's just my motivation as a human being. You know, there is some effort behind all this. I just didn't learn this just by that, but also setting up the video and all that is a bit of effort behind. So just by you putting some likes or putting some comments, participating, being here, you know, it motivates me to carry on. You know, we still have many videos to come. You still have a lot of benefit you can obtain if you follow this series and things like that. And also invite your friends, like my page. Yeah. So you feel free, please feel free to contact me if you need my help. So no comments, just wait for a few seconds more. If no comments, so I can tell you that that's it for today. Dr. Francisco, wishing you the best possible health. Take care. Bye bye.